The pelvis is the area between your hips, placed between your hips that holds up your reproductive organs. So you can think of your pelvic floor as a combination of tissues and muscles that basically hold your organs in place. Now, it's extremely important to understand that the pelvic floor gets weaker and weaker over time. Certain things that cause your pelvic floor to get weak is pregnancy in women, childbirth sometimes, having 2 or 3 children. You know, this flow tends to get weak over time and it distends, putting pressure on the bladder. As we age as well, many senior citizens today, as well as young people, have a problem of urine incontinence, which means that they cannot control their bladder movement. And this can be embarrassing, this can be troublesome, this can be cumbersome, but it doesn't have to happen in most cases. You see, we live in a world where we accept a medical condition, and when there's nothing to be done, we think that there's nothing that can be done. But when we understand the anatomy of the human body, what we understand is there are certain muscles, and wherever there is a muscle, we have the ability to strengthen that muscle. And when we strengthen that muscle can do the job in the human body the way it was designed to. So let's go back to this area between your hips, the pelvis. And that pelvis holds your reproductive organs up. You have your pelvic floor below, which is a combination of tissues and muscles. If these tissues and muscles get weaker and weaker, the floor distends. And because of that, you have a problem with bladder control. Now, if you have a problem with bladder control, it has innumerable other issues like infections and UTIs and bacterial infections and all of that stuff. So as we're aging, and this is a shout out to all the senior citizens who suffer from urine incontinence, there are simple exercises that you can do every single day that makes these muscles stronger and lets you get control over your incontinence. Now, urinary incontinence is also caused when people go through certain chemos and radiations, and especially men who go through prostrate surgeries or prostate cancers. Again, because of the radiation and the chemotherapy or the intense drugs that you take, the muscles start weakening. For women and men who have a lot of abdominal fat, especially in the lower region, that abdominal fat pushes down on the pelvis region, making it weaker and weaker over time. So it's always a good idea to make sure that we don't have too much of abdominal fat, so we take that pressure off our pelvic floor. Now, having a weak pelvic floor also comes in the way of your sexual life and your sexual function. There are so many people out there who have erectile dysfunction, or they have sexual functions, low libido. Again, it is caused because the very muscle that controls many of the actions are weak. And then we resort to taking treatments that may not be necessary. Sometimes all we have to do is strengthen the pelvic region. So there are a couple of exercises. Obviously, I'm not going to be able to demonstrate it today, but you can Google it, you can YouTube it, or you can speak to your trainers to teach you these exercises. But I'm going to tell you one of them, which is extremely powerful, and you have the ability of doing it right now and strengthening that region no matter how old you are or how young you are. Which brings us back to the importance of exercise. When we do normal exercises like squats and lunges, we automatically clench these muscles. And when you clench these muscles, how do muscles get stronger? When they relax and they contract. Every muscle, be it your biceps, be it your chest, be it your legs, any muscle in the body, including your pelvic muscles, they get stronger when they can relax and when they can contract. So now, how do we find our pelvic muscles? So now this is a little bit odd, but I'm going to throw it right out there. So for women, if you want to determine where your pelvic muscles are and how they work, because it's important for you to recognize that these muscles are getting worked out when you do any of the exercises we're going to talk about. So it's very simple. You clean your finger and you insert it into your vagina. And then you try to clench your vagina over your finger. Now, the muscles that create the tightening over the finger are basically the muscles that you need to tighten for the pelvic muscles and the pelvic region to work. For men, it's a little bit different. You clean your finger and you gently insert it into your rectum. And with your rectum muscle, you try to clench your finger using that muscle. And that very muscle which you observe is clenching your finger is the same muscle that you should feel contracting and relaxing when you do a set of exercises called Kegel exercises. Now, many of you would have heard about Kegel exercises, especially women who have gone through childbirth. Your gynecologist may have told you to practice Kegel exercises because that's what basically strengthens your pelvic flow post-delivery of your child. And the quicker you make that flow stronger, the faster you are able to lose all that pregnancy fat and also prevent the sagging of your core. But too many people jump into dieting, too many people jump into intensive workouts post-pregnancy, which is something I'm totally against. You've just gone through an entire journey of 9 months of pregnancy, and then you go through a delivery, which is very hard on the human body. Not just physically, but psychosomatically, emotionally, and mentally as well. And then you put your body through more stress of dieting and extensive exercises and intensive exercises to lose that weight quickly, which is why most women struggle more and more when they get into this route. You need rest, you need the right amount of nutrition, and you got to work on Kegel exercises to first repair the muscles which are distended. And when you repair those muscles and strengthen those muscles, you can start strengthening your core. And as your core gets stronger, that's when you start getting more firmness and tone in your stomach area. And that's when you start doing your squats and your lunges and all the other exercises. It's as simple as that. So Kegel exercises for men and women as well. Because men, we have prostrates, and when those prostrates get enlarged, that creates problems for us as well. We lose ability of those muscles. People who are constipated are constantly straining to pass out their stool. And when you strain, you see you get piles and hemorrhoids, and you weaken the muscles. People who constantly take laxatives every single night just to get a bowel movement in the morning also weaken this entire area. And over time, we lose control of our bowel movement, and we have urine incontinence. Now, Kegel exercises are very simple. Understand this very clearly. Now, you have to imagine that you're peeing. Okay, you're urinating. So imagine that you start urinating. Now, while the flow of urine is passing out of you, you suddenly stop the flow of urine. To do that, you're going to clench certain muscles that I spoke about. When you clench those muscles, that is the exercise required to strengthen your pelvic region. Now, it's not a good thing for you to do it while you're urinating. You got to imagine you're doing it. So the first time, just to get the sensation and the movement right, while you're peeing, stop halfway and recognize the muscles that you clench to stop the urine flow. You should not do this exercise when you have a full bladder, and you should not do this exercise while urinating because you can cause infection. So the idea is to do it the first time while you're urinating, identify the muscles, or identify the muscles with the first two steps that I told you, either the finger inserted in the vagina or the finger for a male inserted in the rectum. Once you identify the muscles, you can do it right now. You can close your eyes and imagine that you're peeing, and now clench to stop peeing. Whatever it is that you clench to stop peeing. And that is a Kegel exercise. Now you can do this, hold it for about 5 seconds and release. Wait for 10 seconds, do it again, 3 sets. Then you can hold it for about 10 seconds. Release, rest, clench, 10 seconds, release, rest. You can do 3 to 4 sets of this. Remember, if it creates discomfort for you or any pain, stop it immediately because you may not be doing it the right way. But you don't have to just do that. There's the brilliance of yoga. Everyone knows the bridge position, where you lie on your back, your feet up, and then you slowly push your butt up in a very gentle manner. As you do this, you'll find that same clenching action happening. Again, that is a great exercise for your pelvic region and your pelvic floor. So if you do these 2 exercises, and anyone out there, senior citizens, the more you move, the healthier you will be. It is not a myth that as you age, you gotta, be less active and sit at home and watch TV and all of that stuff. I can promise you, go out for walks, keep active, do a little bit of gardening, continue doing all the work that you do. Age is just a number. The more active you are, you utilize these muscles. You see, muscles have a memory. If you stop using them, they stop working for you. It's as simple as that. So everyone has you may want to teach your parents how to do Kegel exercises. You may want to do it yourself and strengthen that pelvic floor, because it's a muscle that gets weaker over time. And again, people who don't urinate frequently, who hold on that urine in their bladder until the last moment, you're weakening your pelvic floor automatically. So remember, all Kegel exercises need to be done when your bladder is empty, never while you have urine in it. And so this is something that all of you can add to your lifestyle, especially senior citizens, to prevent or to even make your urine incontinence better. Have a great evening, everyone. Until next time, eat smart, move more, sleep right, and breathe deep.